Hi everyone, this is Brian Wormers. I'm going to be the faculty for NUR305, Cultural, Spiritual, and Ethical Dimensions of Holistic Care. This is going to be an online course that's asynchronous, meaning that you can work ahead at your own pace. There are due dates with this course, but there's no set time that we meet, either online or in person. So this is going to be a completely online course. So for this video, I'm just going to record a few overviews of the course and go over the syllabus with you. So as a course overview, some of the things you're going to see is this main roadmap here, and this will answer a lot of questions. So our meeting schedule, this is online, no scheduled class meetings or physical classroom time. I do have office hours. You can come meet me at that point in time if you want to, or you can schedule something with me and we can meet at that point in time, but there is no office or there's no class time that we have to meet. How to find important course announcements. So there is news and announcements here. If something's important and it's coming out, I'm probably going to email you. And so check your emails, and if anything changes, I'll let you know. Important course resources. So we've got resource tabs over here, as well as your coursework and forums and stuff that I think that you've probably utilized before. So how to find course assignments, surprisingly enough, coursework. Course grades will be in gradebook. Online learning tools, we're going to use a variety of different things in this course. So the LMS or My USF here is going to be one of the main things, and this is going to be the main modality for driving all of this. You might use like Zoom in case you want to have a video conference with me sometime. You can use YouTube for your presentation, PowerPoint for your presentation, or you can use a variety of other things. Email is one of the main things, so like I said, check that in case there's any changes. How to contact me. Email is probably one of the easiest ways. You can look me up on Navigate. You can use my cell phone. You can call my office phone number, which, as a little side note, I've got it forwarded onto my cell phone. So if you call that office number, it will reroute you into my cell phone. Or you can see me in person. So if you need other support, Academic Success Center, Mears Library, Register, all these things are available for you to help you out with this course and throughout the semester. So within this, you will have a couple different modules. So the orientation of the course is what you're listening to right now. So I'm guessing that you found it, even though I don't have it recorded and posted yet. But it'll be about right here, and this is where you should find it. Second thing, syllabus. Well, I have emailed it out to you. This is where it's going to live, underneath this tab, and it's going to be the latest and greatest uploaded one. So speaking of that, I'm going to bring that over into this, and we are going to kind of walk through this one before we go into just the remainder of the LMS. So I'll let you read some of this stuff on your own. But this course is going to run from August 27th to December 13th, asynchronously, like we talked about before, in an online format. So this is NUR305, Cultural, Spiritual, and Ethical Dimensions of Holistic Care. It's worth 3 credits, and it's online learning being taught by me. And this is ways to get a hold of me. So we're going to do lots of fun things in this course and get you to know about yourself as well as other cultures. So you have to know about your own culture and your own spirituality and your own ethics before you help others, because it does help you understand where other people are coming from. And it also helps you maybe respond to other people differently, realizing that people might have different views than you do. And so we're going to look at how that influences your nursing practice. We're going to look at the purpose. The purpose of this course is to explore that interface between cultural and spiritual beliefs and practice of nursing. We're going to look at some of the differences in cultural healthcare practices and beliefs. We're going to look at spiritual approaches to assessment and intervention. How do we talk to people about this? How do we bring that into our professional lives? And then we will look at some of the ethical components, including ethical decision makings, and how we do that within a nursing framework. So this is a diverse modality course using lots of different things, but it's going to be a through distance online course. Learning outcomes, hopefully by the end of this, you should be able to discuss some of the basic concepts of culture, health, illness, healing, through a variety of nursing theoretical perspectives. We're going to look at areas of growth and personal awareness regarding cultural, spiritual, and ethical issues. and then apply some of that content to a specific cultural group or clinical practice. You will apply the clinical judgment model in a culturally and spiritual sensitive manner while performing a cultural spiritual assessment. You will discuss the role spirituality and ethics plays in moral reason. You will look at and discuss the holistic ideal of body-spirit connection as it relates to nursing, and then identify the professional role that nurses play within spiritual care of patients. You will look at and explore the meaning of autonomy, beneficence, non-maleficence, veracity, confidentiality, justice, and fidelity. These are key terms I expect you to be using in this course. So learn what they mean and then utilize it throughout the course, because you'll need this for your nursing career. And then discuss personal disciplines that will show ethical, emotional, spiritual, and professional growth. How are you going to do this? How often do you need some self-reflection? And then you're going to synthesize this all together and then have a big presentation at the end. So upon completion of this course, this is going to meet your IA awareness or intercultural awareness for USF by looking at identifying how cultural practices reflect a particular culture and perspective, and then compare and contrast products, practices, and perspectives of other cultures. So nursing school outcomes, mission, goals, you can all see that right here with this link. Theoretical basis, yes, we do have a plan for what we do and why we're doing it. If you're really curious about it, click on these links below. Required resources. You should have your APA book, but that's a required thing. And then in addition, Purnell. This is available at the Wagner Library. It's also on some course reserves at the Mirror Library. And then, so you do not have to buy this one. And other things will be provided for you. So you really do not have to purchase anything at this point in time. Teaching methodology, lots of different things in this course, and you will see that. Evaluation, most of it's going to be participation and professionalism. Are you turning your assignments in on time? Are you doing your forum posts? Are you doing a lot of these things that you should be doing with your learning modules and assignments? You will have culturally and linguistically appropriated services in nursing. So this is an outside course that you're going to kind of take within this course to learn about culture and how to interact with other groups. There are 4 sections of this, and you can kind of see it in the timeline below as to when each of these are due. And then you will have a final presentation, which is worth 75% of this 40%. So think 30% of your total grade is how you do on this presentation. You will need to provide peer constructive feedback. That's not, just like I don't want to hear it in your forum posts either, but, great posting, well done, I appreciated how you did this. I too like this or thought this. Great job. It has to be better than that. I want you to start having peer constructive feedback because I want you to do that once you graduate. And sometimes it's hard. It's hard to criticize your peers. But ultimately, your goal is to make your patients better and help them with their patients too. So if you've got a better way of doing something that might help them out, let them know. So for the final presentation, it's going to be like, how was the audio? How was the visuals? How was the content? Did they make sense? Was it clear? Did it flow well? Did they have enough resources? Were the references up to date and posted clearly so you could reference them and understand where they were getting their material from? Those kind of things. You can use the same kind of rubric that I'm going to use to grade them as your basis for this. But don't think about this as being punitive. Think about this as a way to help them grow and develop. You've still got lots of nursing courses left, and if you can improve on how your peers are going to do in their presentations, that will help them out later on in their career and later on in nursing school. So be kind and help them out. Grading, typically nursing, 90, 80, 70, 60. You need a B- to pass this course and advance within the nursing program. Responsibilities, you need to do the signed paperwork and presentations. This should be in APA format, generally speaking, except when stated that you don't have to. Learning modules, you have to do learning modules. There's going to be 1 to 2 of those every week. There'll be quizzes and different things like that embedded within the soft chalk module. Online quizzes, there are some quizzes with this. I think you know how to do a quiz. Be nice, especially in this course. Look at some of this stuff for some guidelines for etiquette and professionalism. But honestly, just treat others with respect. You don't have to agree to their line of thinking. You don't have to agree to what they maybe said, but you do have to treat them with respect. I do expect you to participate, and this is going to be on a weekly basis. You can work forward in this course, but you do need to have stuff done by the due date. So you can work forward, and I'm giving you that opportunity, and you can take things out of order. Like if you want to go do the cultural journey, which we'll talk about here in a little bit, go for it. You can do that week 2 and get done with it, cross off your list, and then move on. But for late assignments, I really don't accept any. I will accept Comfort Pass if you just need a little break. Email me. You don't even have to tell me why. You get 2 of these, and I'll extend it out 1 week. Can't do it on your main assignment at the end. You can't do it on the peer feedback, but for most other things, I will extend until the end of the semester. But all this stuff has to be handed in by 12/8 so I can grade it and get your grades in by the end of the semester. Policy and procedures, you've seen this on other stuff throughout the campus, including your nursing courses, but academic honesty, make sure that you are using your own stuff. Be very careful with ChatGPT or any other things like that. All too often it is kind of easy to tell that it's not your writing, so don't be doing that. Compliance with the ADA, feel free to contact me if you have any questions about this, or the Academic Success Center. Program assessment, every semester I get feedback from students, love it, and then I utilize that to change this course, adapt this course, and upgrade things as appropriate. Copyright, so don't do copyright infringement on this. So cite and reference your materials. And the status of the syllabus, I put the statement in here. I don't think anything's going to really change in this semester in this course, but who knows, and if it does, I'll let you know. Course schedule, we've got it broken down into each module, and so you're going to have different topics and then different assignments with that. And so hopefully right now you're watching a video of the course introduction, which is this, and you're done. I'm going to try and keep very similar for when your initial posting is due, and then all your assignments are due on Sunday. By all means, you can work forward. You can get stuff done earlier than that. If you want to have your weekends free, get it in, turn it in on Friday. I'm completely fine with that. But this is your due date for when things have to be in. So I'm not going to run through all these different things. I'll hit some of the major things. Forum posting, I think you can understand that, but make sure you have 1 great initial posting and 2 replies to peers. Spiritual roots quiz, that's just a quiz. Talking about the soft chalk. Next week we're going to start talking about soft chalk module and forum post, and then just kind of orient yourself to this tool that's going to be due the subsequent week. We'll talk about spiritual needs of a patient, so we'll go through that learning module and then use that FICA tool, and then we'll have a spiritual assessment quiz. Module 4, basics of moral reasoning and bioethics, so it's soft chalk module with this one. Code of ethics, so do the module, forum post and reply. You're kind of seeing a continuance or a continuity here, hopefully. Module 6, talking about faith, ideals, values, ethics, morals, and virtue. So with this, we're going to have a soft chalk module, and then I want you to watch the movie Concussion. So this can be done in groups up to 4 people. You can watch it as a whole class. So if you guys, somebody's got the movie, you guys want to throw it in the DVD player and watch it after somebody else's class, all of you as a whole can watch the movie together, but you need to do your write-up in no more than 4 people. All right, transcultural diversity in healthcare. So we're looking at this, forum post with replies, self-assessment. This is going to be an interesting thing that's going to be, take some time with this and really get to understand yourself with this one. APA formatting is not required. So Next, we're going to talk about cultural competence and what that all means, and some cultural care theories. How do we deal with that? So there is some readings with this one that's linked in your resources. And then you're going to start on that culturally and linguistically appropriate services in nursing. And so sign up for this course and have this first part done at this date. We will continue that, so you're going to see part 2, part 3, and course 4 will be down here. So I tried to space it out. If you want to get them all done this week, do course 1, 2, 3, and 4. Boom, hammer them out, and just upload them, and then guess what? You're done. Awesome, huh? So, looking at Module 9, Assessment and Data Collection. So how do we do that and what do we talk about? This is going to be getting baseline information on your patients. So there is a quiz with this one. There's some reading with this one. Health disparities. So we'll do some of these type of readings as well as a forum discussion, and then looking at, that course 3 of this. Perspective on nursing and global health. So some readings, forum posts. You have to watch the movie Extremists, and so this is through Netflix. So if you've got a Netflix account, that's great. You can watch this. Otherwise, if you do not, then you can get a trial of Netflix or see if you can find somebody in the class that does. Once again, you can watch the movie all together and as a group, hammer it all out as one big class, and then do your write-up. Your write-up is individual for this one. And then course 4 of the class. Module 12, talking about nursing care. And so some reading things, forum discussion, cultural quiz. Module 13, so readings, forum post, cultural quiz, and then a cultural journey. So this cultural journey is meant to be a fun thing. This is going to be you stepping outside of your comfort zone. Try some place that you haven't been before or haven't experienced. What I mean by that is, there's lots of great restaurants around town that are from a culture that you've never experienced before, and whether that's Japanese, Mexican, Guatemalan, Ethiopian. I mean, there's some really cool places in Sioux Falls that you can try. It can be out of the city, it can be out of the state even. I don't care, but I want you to push your boundaries a little bit. This doesn't have to be an expensive thing. This doesn't have to be, 7-course meal. You could actually go into like a shop and maybe buy a $2 pack of gum or something like that. But there's lots of different things, and within that resources, I gave you some options for this one. But there's like Eastern European markets. It's really kind of fascinating to see like what kind of medications they carry in there, and trying to figure out what they are when they are written in a Russian language, or different stuff like that. You can go to like a cultural fair. You can go to a I think the Sundances are done, but you can go to any sort of Native American ceremonies or different things like that. So you can use a lot of different things. I'm just trying to push you and to let you try something different. Going to McDonald's and calling it an American is not going to work. I want you to push yourself out a little bit deeper than that. Just like Taco Bell is not going to be counting for Mexican, and Pizza Hut is not Italian. I really want you to go into something that's going to push your boundaries and help you grow as a person. If you have any questions on that, talk to me. I've got lots of great places for you to try and things for you to do. Last thing is you will have a group presentation, so you can do this individually or in groups of up to 4 students. This is going to be talking about an aspect of your pick. So you get to choose an ethical, cultural, and spiritual situation where you're going to talk like, what do Catholics think about abortion? What do Muslims think about stem cell research? Any of those things are kind of fine, but you can look at the ethical, cultural, and spiritual aspects of some of these latest, greatest healthcare type of situations. And you're going to use the checklist and the rubric provided and cover these different areas and talk about, what does nursing think? What does healthcare think? What does, what are the religious beliefs of these? What are the pros? What are the advantages? As a nurse, what do we need to know about these type of situations? How do we help those patients that are, working through this or working in these situations? So it should be kind of fun. I want you to do this, but I need you to do a good job because it is going to be quite a bit of your grade for this course. So tied to that, you need to do constructive feedback, and I mentioned that up above. And it's not just, yeah, great presentation. I too agree with this. Great posting. No. How can they better themselves? Did they have a fallacy of logic? Did they not have good audio? Did they not have good visual? Was it too busy on their slides? Was it not busy enough? Should they had more images? Think of ways that they could improve that presentation if they were going to give that on like a national level. I really do want you to have a good quality presentation, and I do want you to help your peers with this and to better what they've got. So early on in the semester, go into the forum post though with this and let me know who your group is and what your topic is. So, all right, and so then we'll be done with this. So that is the syllabus. So within the course, we kind of mentioned a few different things. So attendance, I'll take that. That's going to be based on you completing your coursework. Course organizer, some people love it, some people don't, but kind of gives you a heads up for what's going on in the group. Resources, so these are the things that are not graded. So if you got a soft talk module that you want to reference, that will be listed in here, and you feel free to go into this and utilize that for your handouts and stuff like that. So remember, this is where you go when you don't want it graded. Coursework is where you go when you do want it graded. So if you're doing a soft talk module for your assignments, it should be in here with a link, and then that should drop over and carry into this, so you get credit for your assignment. But yeah, this is how you hit your forum posts and quizzes and all those kind of different things within the different modules. And like I said, you can work forward as you need to. Gradebook, if you're curious about your scores, this is where it's going to be. Mine will look a little different. Forum posting, if you just want to access the forum, this is a way to do it. Roster, I'm not sure if you guys have access to that, but that's just saying who's there. And news and announcements. So this is just an overview of the course. If you have questions with it, please ask. This is kind of an individual thing. I will be checking up and reading. I read every forum post that you do or every assignment that you do. I'll give some feedback as we go through on the course. But this is kind of an individual thing. This course is asynchronous, and this, I expect you to be pretty independent with this. So if you have questions, please ask. Know that I'm available. I'm here to help. And if you have questions, don't be afraid. So, all right. I hope you have fun with this course. I think you're going to, and hopefully you learn a little bit about yourself as well as the patients that you're going to care for. All right. See ya.